Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Today, my name is Nur Syazwani Syafiqah binti Syahrizam, and my group members, which is Maisha Sofia binti Muhammad Sabri and also Nurpatin Husna binti Zakaria, want to present about AIDS. Do you know the definition of AIDS? Let's me tell. AIDS stands of acute immunodeficiency syndrome. Is final stage of infection with HIV. It happens the body immune system badly damaged because of the virus.
Where did AIDS come from? Scientists have traced the origin of HIV back to chimpanzees and simian immunodeficiency virus (SIV) and HIV-like virus that attacks the immune system of monkeys and apes. In 1999, researchers identified a strain of chimpanzee SIV called SIV-CPZ was nearly identified to HIV to be covered. Next, symptoms of AIDS. Do you know what symptoms of AIDS? Let me tell you. Symptoms of AIDS can include: first, blurred vision; second, a dry cough; third, a person will get sweats at night; fourth, white spot on the tongue or mouth; fifth, shortness of breath or dyspnea; sixth, swollen glands lasting for a week; seven, diarrhea, which is usually persistent or chronic; 8. A fever of over 37 degrees Celsius that lasts for a week; 8. Continuous fatigue; and 9. An international weight loss.
HIV infection happen in 3 stages. Without treatment, it gets worse over time and eventually overpowered your immune system. Your symptom will depend on your stage. First stage, acute HIV infection symptoms. HIV may have symptoms within 2 to 6 weeks after they gotten the virus. This when your body immune system put up a fight. The symptoms are similar to those of all other viral illness, and they often compare to the flu, such as first, headache; number 2, itching muscle; number 3, sore throat; number 4, swollen lymph nodes; number 5, a red rash that doesn't itch; number 6, ulcer. If you have these symptoms, you need to meet the doctor. Second stage is clinical latency symptom. After your immune system lost the battle with HIV, the flu-like symptom will go away, but there's a lot going on inside your body. Most people don't have symptoms. They can't see or feel. You may not realize that you're infection and can pass HIV on to others. If you're taking ART, you might stay in this phase for decades. You can pass the virus on to other people, but it's extremely rare if you take your medicines. Third stage, AIDS symptoms. You didn't know earlier that you were infection with HIV. You may realize it after you have some of the symptoms. Number 1, being tired all the times. Number 2, swollen lymph nodes in your neck or groin. Number 3, fever that lasts more than 3 days. Number 4, night sweat. Number 5, weight loss with no obvious reason. Number 6, purplish spot on your skin that doesn't go away. Number 7, shortness of breath. Number 8, severe long-lasting diarrhea. Number 9, yeast infection in your mouth, throat, and or vagina. Number 10, bruise or bleeding. You can explain neurologistic symptoms such as memory loss, confusion, balance, problem, behavior change, or so on. And that's it. HIV have 3 stages, and every stage you need to always be careful. Okay. How to prevent AIDS from happening? One of the way to prevent it are: number 1, using condom to prevent other sexual transmitted infection. Number 2, having vaccination for potential opportunistic infection. Number 3, avoiding food with high risk of contamination such as undercooked egg and meat, unpasteurized dairy or fruit juice, and raw seed sprout. Number 4, not drinking water straight from lake or river or unfiltered tap water in certain countries. Number 5, asking doctors about relevant vaccination and ways to limit exposure to pathogens at work, at home, and on a vacation. Number 6, antibiotic, antifungal, and antiparasitic drugs can help treat opportunistic infection. That's all for us. Thank you. Assalamualaikum.